Welcome back to Count Mental Electronic Forum, West Bengal. Today we are going to discuss about cervical spondylosis, which is also known as arthritis of the neck. This arises as a result of previous trauma to the spine or to have or had car accident or any fall or other spinal injury sometime during the sports, play competitive sports, perform strenuous physical activity at work and have had a previous neck or back surgery. There are some risk factors of this cervical spondylosis, of which are family history, which may indicate a genetic risk, advancing age, wear and tear of joint such as from repeated injury or using the neck in their activity mostly with loads, smoking, diabetes, high blood pressure and obesity. And in this cervical spondylosis, we get some peculiar symptoms through which we can understand what is going on, whether it is the episode going to be of a cervical spondylosis in the neck or not. In this, first we get pain and stiffness in neck muscles. It increases gradually. Patient get or may suffer from vertigo, headache, followed by nausea. Patient also gets imbalance while walking, feels weakness in limbs, pain that radiates from neck to the hands, having sensation of numbness in finger and limbs. To confirm the diagnosis, we may go for X-ray, MRI, myelogram, CT scan, electromyography and nerve conduction studies. So when patient come to us with all these symptoms, we first decide whether the case is surgical or non-surgical. Surgical means that there may be chances of the decreased intervertebral gaps of the cervical vertebra where nerves are tagged and pain becomes worsened. Patient cannot tolerate. Sometimes we get severe or large osteophytes, and during that what happens, the space for the spinal nerves or even the spines becomes narrow. For this condition, we refer the cases for surgical and then we diagnose if the patient has some problems or symptom where we can treat the patient following the non-surgical parts or giving non-surgical treatment, then we advise the patient to go for the physiotherapy where TENS or ultrasounds are given. Using TENS and ultrasound therapy, the muscles around the neck becomes loose, spasm muscles get reliefs and pain decreases. Along with that, in severe cases, we advise the patient to get heated pad or cold pack अथवा ice pack. Sometimes we also advise the patient to use soft neck brace where patient get temporary relief and get strength in the neck. Out of them, or after having all this advice, we also look for the medicines. In electropathy, there are several medicines which we can use to reduce spasm of the muscles in neck, pain, numbness, and weakness of the limbs too. So for that, we use cancer so 5, which is very good remedy, works on spasmodic pain and muscles spasm. If we get, we prescribe it and we get very nice result. As analgesic, here angiotico 1 is given. If we get there is numbness and weakness of the limbs, so along with angiotico 1, we give Vertigo 1. For external use, as analgesic and sometimes antipyretic, to reduce inflammation too, we use white electricity, and for spasmodic pain, we use yellow electricity. So these are the very good medicines which we use successfully in all cases of cervical spondylosis. Along with that, we also advise the patient some yogas or exercise which also help to cure spondylosis of the cervical region. Out of them, we sometimes advise neck exercises. Now see the yoga or exercise which we are going to advise for the patient, and here the patient will just turn the head left and right. Then right. One thing always mind, whenever we turn the head left, we will hold for 5 to 10 counts. Then we will come back to the right. In this way we repeat it 5 to 10 times. Now see the exercises which we are going to show for cervical spondylosis. Number 1 is head turning. So patient will turn his head to the left first and will hold for 5 to 10 counts. Then come back to right, slowly and slowly. Again hold for 5 to 10 counts as per capability of the patient. Again repeat this exercise 5 to 10 times. You will get relief. One muscles will be relaxed. Now relax. Second is the head should be turned backward and forward. So see here, backward first, hold for 5 to 10 counts, come to forward, chin to be touched to the chest, hold for 5 to 10 counts, now up, back, count 5 to 10 times, relax. This also should be repeated 5 to 10 times. Then after the third, head tilt, means head must be tilt side to side. So now see, first left, again hold, count for 5 to 10 times, then come to the right, slowly hold it and count 5 to 10 times, then left, then right, relax. It should be also repeated 5 to 10 times or as per capability of the patient. Along with that, the patient should take advice of yoga therapists. There, the yoga therapist may advise Sushma Vyama, Bhujangasan, Salbhasan, Dhanurasan, Supt Ustrasan, Matsyasana, deep inhalation and exhalation, Nadisodhan and Ujjayi Pranayama. And all these should be done under the supervision of the expert yoga therapist, so that any complication may not arise, as because the asanas that varies from patient to patient, and the yoga therapist, he will decide what therapy or what yoga or what exercise to be given to the specific patient. So you now follow these advices, take advice of the expert and get cured. Today is the end of this episode. Next episode shall be brought soon. For more information, please follow us and wait till next video.